Let's get the other side now. Democrats rolling out a new strategy to fight Republicans, like the congressman, who are trying to repeal the health care law. They say that repealing it will increase the federal deficit. But the head of the nonpartisan Congressional Budget Office says it is uncertain how the law will impact the federal budget. Democratic Congressman Robert Andrews from New Jersey says Republicans are indeed being hypocritical when it comes to health care. Congressman, why do you say the Republicans are hypocrites?
Well, because the Congressional Budget Office earlier in 2010 gave an authoritative opinion that said that the health care law reduces the deficit. And they've not backed off that opinion at all. So, I mean, this is sort of like the booth review at an NFL game when the coach throws the red flag on the field. You go and have somebody look at the film. The CBOs, the people look at the film. They've looked at it and they've said the health care law reduces the deficit. So if our friends want to repeal the law, then they're increasing the deficit, which is the main promise they ran on the reducing the deficit, I thought.
Well, the CBO's official score does say that it reduces the deficit over the next decade. However, the CBO director wrote just days after health care was passed, quote, the CBO estimates of the net savings that would result from the legislation have a roughly equal chance of turning out to be too high or too low. In other words, the director's saying himself, we're not really sure how it will play out.
But the way the CBO works is it issues an authoritative opinion when the Congress is about to consider a bill. It issued such an opinion when the health care bill was voted on, and they said in their authoritative opinion that the law would reduce the deficit. Now, they may change that, but they haven't changed it yet. And I would say this. I would offer to my friend from Colorado we just heard that if they would make the repeal of the law contingent upon the Congressional Budget Office certifying that it would not increase the deficit to repeal it, maybe that's something we could compromise on.
Is that something that you would put forth in the House? Would you make that deal?
I'd think about that. You know, I will tell you, we just had a bipartisan season of cooperation here in the last couple weeks, and I think it's disappointing that the first day the new majority is going to cast a vote to go back on its promise to reduce the deficit and the debt. The Congressional Budget Office has said that the health care law reduces the deficit. If they change their opinion, then maybe we should fix that law. But if they don't change their opinion, if they continue to say, as they have since last March, that the health care law reduces the deficit, then I would challenge the new majority not to repeal the law because it will increase the deficit.
Now, Congressman, the Kaiser Family Foundation has a new poll showing that 49% of the country says they would like the law to go away. Now, in some of these freshman congresspeople's cases, they ran as their primary platform, so they have an obligation to their constituents to put it out there. If 70% of your constituents said, you know, Congressman Andrews, let's repeal it, would you push for that?
Yeah, I would represent my constituents. My constituents do not say that, by the way, but I thought I heard the #1 thing these guys ran on was reducing the deficit and the debt. And I think that they need to tell us whether repealing the health care bill, in fact, increases the deficit. Our official nonpartisan auditor, the Congressional Budget Office, says it does.
But that is assuming assuming a slowdown in the increase in the rates of Medicare, and even the Center for Medicaid and Medicare Studies, the CMS's own numbers, Congressman, say they are planning for a $251 billion increase in costs over the next 10 years.
Which was baked into. Have you read the CBO report that we're talking about?
I read them today. I read the CBO director's blog. I read the CMS report. Believe me, I got health care coming out of my ears, and I wish I didn't because I thought we had this debate last year.
Have you read the CBO letter from March of 2010?
Which one is that? Are you talking about the official estimate or the CBO director's blog from March 17th, where they say we don't really know what this will do?
Have you read the official estimate or not?
Of course I have. I just can't pluck out the exact date letter that you're talking about. I got it all here. Point to me to the page. Which page are you talking about?
March of 2010, and it says that the projected decrease in deficit is $143 billion. Now, they've never changed that estimate. So repealing the health care law increases the deficit, doesn't it?
Not necessarily, because I'll throw this out. Here's
how doesn't it?
Here's something else. I'm just going to quote the CBO. I'm not going to give you my opinion. Congressman. Okay? The CBO blog also, I believe it's March 17th. I've got
what?
No, what? I can't read the
CBO works.
I can't read the CBO director's comments.
Sure you can, but the
okay,
way
then
the
let me
CBO
read them and you can respond.
It issues an official letter that's official position. Now they can comment on that, but have they changed their official position?
No, they have not.
Have they?
No, they have not.
Okay. Well, then repealing the health care law increases the deficit, doesn't it?
But when I have the CBO director writing for the world to see that the budgetary impact...
You just told your audience that they haven't changed their official position. So given that fact, doesn't repealing the health care bill increase the deficit?
Well, the CBO director says it's unclear, Congressman. That's the CBO's own director saying that. Yes, the official score says it will. The CBO director...
Has he changed his official score?
The CBO has not changed his official score because listen.
As of this point, would repealing the health care law increase the deficit?
According to the CBO's official score, no.
Sure it would.
Oh, it
repealing the law would increase the deficit. Yes, it would.
Oh, repealing the law. Okay, I didn't hear it. According to the CBO's official score, yes.
So doesn't a vote to repeal the deficit or repeal the health care law violate the promise to decrease the deficit?
Not unless if you cut other spending, that would balance it out.
Are they going?
So let's assume the CBO's official numbers, as you are very eager to cite, are accurate.
So if the repeal bill that's coming to the House floor in the second week of January doesn't cut other spending, then it increases the deficit, right?
I guess it does.
It does.
If we don't cut something else. If we don't cut something else,
I agree.
And if the CBO director,
and I think we should.
Okay, you know what? We're just going to go in circles. We'll wait and see if the CBO changes
we're not going in
its
circles.
estimate. Read the CBO director's blog, and you can hear what he says.
I have read it.
Okay, you have. March 17th. Go online.
But I'm glad to hear you say. But I'm glad to hear you say that if the repeal bill does not cut other spending, which I would like to do too, I agree with you.
Okay, good.
Then it does increase the deficit.
We have something in common.
We do.
All right. Congressman Robert Andrews of New Jersey, thank you very much.
Thanks, Brian.
All right.